This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Perfect. So I'm going to get started. Share my screen. Let's see. Sorry, I have to go in and change my setting first to allow sharing.
Love the painting, Jesse.
Apparently I have to leave the meeting, so I'll be right back.
Dustin, should we talk about general things about Royal Oak while we're waiting?
Yeah, sure. So I'm Dustin. I'm one of the PGY3s. I got Ray here with me and Jesse. He's one of our 4s. Having some technical difficulties right now. So we got a PowerPoint. I'm not sure why the video is not working, but we have a PowerPoint just kind of overlaying our program and what it's all about and our curriculum and everything. But just if you're not familiar with the Royal Oak area, it's kind of a suburb of Detroit. I'd say like 20 minutes from Detroit, 30 minutes from Ann Arbor, probably 45 minutes from Toledo. You have Troy right here. Kind of a little something for everybody. It doesn't matter what you're interested in. If it's tons of good breweries around here, a lot of good sporting events, a lot of good parks and stuff. If you're into that kind of thing, a lot of good golf courses. I'm into that kind of thing. And yeah, just a lot of stuff to do. Our program's really close, and we do a lot of stuff outside of the hospital. So we're going to happy hour, at least once every other week, typically, and then doing other things outside of the hospital as well. And I think Jesse's back, so we're live.
All right, so that wasn't too bad. So I'll get things started. So welcome. Gonna talk a little bit about our program, Beaumont Hospital Royal Oak. So let's get started with kind of the agenda. So we're going to talk a little bit about the leadership, our attendings, our program structure, the hospital perks, didactics, training sites, anything that you see with a star basically is or our recent additions and changes that we've made that we think is making our residency better. And next up, where do our residents go in terms of fellowships versus jobs? And we'll leave a couple minutes for a Q&A at the end. So this is us. So Ray Bauer, he's a PGY2 right now. We have Dustin, who you just listened to. He's our PGY3, and I'm one of the PGY4s, currently chief of this month. So a little bit about our leadership people. So this program was first started by Dr. Miran Laban. He recently retired about, I believe, 2 years ago, 2.5 years ago. He was a founding chairman, and he used to be one of the past AAPM&R presidents as well. Dr. Ronald Taylor, he is still with us, working right now. He's the previous department chair. He's been with us for more than 40 plus years. He's a full professor. And then next up, Dr. Justin Ryuda. He used to be our program director, but he's now the department chair, and he's still very associated with resident teaching, and he rounds with us quite often as well. Dr. Brett Burlingame, he's our program director, assistant professor, and he's been very open to changes that you'll hear in the next few slides, and definitely integrative to the residency. And then we have Dr. Lisa Grant and Susan Weir as well. They're the assistant program directors, as you see. All right, next slide. A couple other people. I know there's a lot of faces on here, but Dr. Maltese, he's the director of Beaumont Choi. So the two hospitals that we mainly rotate are Beaumont Royal Oak and also Beaumont Choi, which are only about 20 to 25 minutes apart, depending on how far you drive or how fast you drive. Dr. Nurula is the director of EMG. And we also started a fellowship this year. So we have Dr. Megan Zisk. She was one of our residents before. So now technically she's a PGY 5 fellow for the EMG MSK fellowship. And then all these attendings, definitely we work with them quite a bit throughout our years. All right, so I'm gonna have Ray talk a little bit about PGY 1 and 2 to you guys.
Okay, can you guys hear me? So first year is PGY 1. So you guys are aware now you're in the application process. There's the categorical versus the, I believe it's called advanced, where it's not connected to the residency program. So the nice thing about our residency program is our first year, the transitional year is directly is at the hospital, is at Royal Oak Beaumont Hospital. You don't have to do it at a separate location. And as you see, there's 5 internal medicine months and 1 month of MICU. And although that can be a lot of work, it's awesome because you ultimately just hone your medicine skills. Because as a second year, as you see, and I'll get into, is when you primarily spend time as the primary resident for the inpatient rehab service. So all the time you spend learning how to do medicine in the first year, you really are able to use it and can feel independent when you get to your second year. The remaining electives, so you do a month of PM&R, which is really cool. It's pretty, schedule friendly. You're just seeing a lot of different things. You're not required to do a lot, but you're just getting a feel for how the residency runs in general. And then the other electives are great because it just goes, it kind of covers the different types of diagnoses that you're going to be responsible to know as a PM&R physician. So that'd be room ortho, emergency med, neurology, and then the elective just depends on if you're an MD or DO. There's a bunch of different electives you can choose from. If you're a DO, then you do a family medicine. That could change. I think Dr. Burlingame is working on making that elective for both, but that's how it currently is right now. And then the second year, so like I was saying, that's the most amount of time you're going to be spending on the floor, as we call it, which is basically just managing the inpatient rehab floor of the hospital. So there's 4 residents. 3 of the residents will be on an inpatient rehab service at a time, and 1 of the residents will be on consults. That's the remaining 3 months. And then your responsibilities are basically just to manage the inpatient rehab floor. You're doing rounds in the morning, taking admits in the afternoon. We only take admits till 4 p.m., which is pretty nice. And then you can leave. So you're never there past 4. And for the other responsibilities besides that, you get pretty good exposure to MSK clinic, P&O clinic, wheelchair clinic. So they're kind of spread out throughout the week. And these are just different fields within PM&R that you need to know. And so they're really, the focus of the clinic is to just learn. So the attendings are there, and they're with each, even if it's not your patient, you're there and you're listening to the attending kind of go through each patient. You can get a good feel for how to manage these types of patients. So that's the gist of it. And I think we're at 8:15 now. So was that a good explanation, Jesse? Or
Perfect.
Pretty good. That was a picture of our first annual golf outing that we just had. I think it was in May or June, and we had a great turnout. A lot of people there. A lot of fun. We're going to try and continue that every year. But I'll talk about PGY 3. Like I said, I'm Dustin. I'm one of the PGY 3s. So it is August. So I've already done my PEDS month, which we do 3 of those months, plus or minus so we do 3 months, but one of them can be an elective actually. So if you're interested in a fellowship, we have a lot of different attendings around that have all done different fellowships, and they all kind of dabble in different things. So if you're interested in like doing, a lot of procedures or something, we have Dr. Bovin. He's a great teacher, always willing to let you do some of the procedures with him. So a lot of people spend a month with him. Dr. Burlingame did sports and spine. A lot of people spend a month with him. And every attending just kind of has their own thing. So you can mix one of those months in there before we apply for fellowship if you want to, which most of us will probably do. And then I already did 1 month of peds with Dr. Dabrowski, brilliant guy. He's been doing peds forever. And that was a great month for me. A lot of, kids with cerebral palsy, managing spasticity. I did a ton of Botox injections. So all around a really good month. And then I did a consult month, which I'm currently on right now. So as the 3, you operate as the senior of the team. You get a lot of autonomy. You're basically the one managing the entire consult list. You're in charge of a junior resident, and then whatever medical students are there, teaching them. And then you kind of talk back and forth with the attendings about when and where you want to round, and you're basically running the whole service. So it's a lot more responsibility than you had as a 2, but I mean, you grow so much as a doctor over the course of even your first month on consults. It's tougher than the other months for sure, but you're definitely learning a ton and doing a lot. And then we have 3 months of ortho, which is on the inpatient rehab, basically the floors, but you're managing mostly ortho cases. So we're in the South Tower of Beaumont on the 9th floor. If you go to the right off the elevators, it's the ortho side. We're on the left side in patient rehab. So the patients basically will come over from that right side to our side. And we'll just manage a lot of like pain medications that you don't get as much of in your second year, because you're doing more just general inpatient rehab. This is a lot more, post-op acute pain management, stuff like that. And also a lot more autonomy. You're doing all your own orders at that point. And then other than that, we also take part in the clinics. We're all in the same resident room when they're doing their clinics as 2s. So we're in there and also learning with them. And then we do 3 months of EMG. So this is definitely a program where you're going to get as many EMG numbers as you want and more. Dr. Narula is our EMG teacher that he does clinics every first and third Thursday. So you and the person on peds will be doing 3 EMGs each basically on Thursday, and then the EMG person does them all month, any inpatient EMG that's ordered. So you learn EMGs just cold. So also a great month. As a 3, all of your months the schedule is very good. Consults is probably the latest you're going to be there, but it's kind of you round once in the morning, once in the afternoon, and usually around 4 or 5. But all the other ones pretty much out by 4. And I'll turn it over to Jesse for PGY4.
All right. So if you noticed, our PGY3 is the first year where we start doing EMG. So 3 months of that during the 3rd year. So during your 4th year, we each rotate for 3 months as chief. So this way it's fair. And also you are the teacher to the PGY3 in terms of the EMGs. So you really do need to know your stuff after 3 months as a 3. So as the 4th month, they rely on you for the teaching. Obviously the attendees are there and they kind of oversee. And as well as we have the fellow that's started this year as well. That's been super helpful, especially during clinic days when the volume is a little bit high. And you also do a little bit of outpatient clinic as well, your own clinic that you staff with the attending, but you pretty much decide on everything you want to do with them, but you still staff with the attending, obviously. We also do 3 months of consults at Choi, which is the hospital that's about 20 minutes away from Beaumont Royal Oak, including some of the inpatient EMGs there as well. And to talk a little bit about or elaborate on the subacute rehab and office and electives. So basically for 3 months, you get to choose pretty much anything you want to do elective wise, whether or not it's rounding with for instance, palliative pain, inpatient, you can do outpatient, office, you can do a procedure month, you can do extra months with our attendings. It's really up to you. And you can even do a research month that one of our other PGY4s is doing currently. And then for the subacute rehab office, it's basically following for the 3 months, you'll be following one attending each per month who does subacute rehab. So meaning that their schedule, they may have 3 half days for subacute rehab, but for the rest of the time, it will be office-based. And you can pick which attendings you want to go with, as long as there's nobody else with them at the same time, based on your interests. For instance, if you're more procedure-based, you can round with attendings or be with the attendings who teach you a little bit more in that aspect, and who does a little bit more as well. But if you're more into, for instance, TBI, we have attendings who sees TBI specific patients in the office as well. So you really get to cater basically all 6 months of elective / SAR office months to your interests as a 4th year. And that's one of the reasons why you see a star for the PGY3 optional elective month, because just this past year, we kind of advocated for a month of elective to be earlier on. So for people to get a little bit more different exposure in terms of their interests, since we all know for fellowships, the interviews are getting earlier and earlier each year, or at least that's the trend.
5 minutes remaining.
Yep. So I'll quickly go over didactics. So basically we have lectures at noon every single day. There are obviously self-study days, and I'll give you an example of what we just had this August. Monday and Tuesday are the core lectures. So depending on which block we're on, for instance, stroke, SCI, TBI, will have core lectures given by most of the time the attendings. For Wednesday, it could be anything related, anatomy, other topics of interest. And then Thursdays, every morning at 7:15, we have EMG lectures. We go over the basis of EMG with Dr. Narula, and then we actually go over 25 plus cases as well. So this runs basically, I believe, about 9 to 10 months out of the year. And every other Thursday, we have anatomy and dissection. You see the first picture on the right. That's Dr. Burlingame, our program director, in the dissecting room. And then what we added on, so obviously you see daily lectures at noon, monthly journal clubs. And what we added on this year is Dr. Bovin has elected to give us an ultrasound series. So this will be every Monday, 11 a.m. at the Skills Lab. This will only be the PGY3 on EMG month and also the Chief month. So it will be only 2 to 3 people, very hands-on small group that he'll teach us each week. We've had a couple sessions already this year. And then Dr. Trevax also gives us a financial lecture series going over about 10 to 11 topics monthly, so an hour per month. This is the sample that I just grabbed from this month. You see that we had TBI lectures, you got pharmacology, EMG lecture. This is the only self-study day on August 5th. And then TBI, a little bit more business of health and medical care from Dr. Grant, who was the CMO of Blue Cross Blue Shield. And then C-spine pathology interventions, spinal cord injury. And then we have going on to next week, neuroanatomy of spinal cord syndromes, shoulder anatomy, and journal club as well to end the month. So pretty packed month, but we really enjoy our lecture series. Call schedule wise, very quickly, PGY2s take about 27 weekdays, 7 Sundays. So the calls go from 5 p.m. to 7 a.m. And it's home call. So you do work the next day. However, most of the questions by the nurses when they page you occur before 11 p.m. Rarely do you get the overnight calls, but you answer them. And we have a pretty solid rapid response team in case the patient needs to be examined in person. So you really don't need to be there majority of the time. I think last year, the entire year, I was the only one who went in one time, and that was for autonomic dysreflexia for a spinal cord injury patient. And then PGY3 is pretty much the same, but a little bit lighter than the PGY2. And PGY4, you don't have any calls. So no weekdays and no weekends.
2 minutes left.
Yep. Moonlight, this is something that's new. Started in the last 6 months or so. So we have Saturday IPR admissions on a rotating basis. So one resident will cover the pager, and we usually have 1 to 2 admissions per week, most of the time, and you get paid. There's also opportunities for residence teachers to teach medical students, and also outside opportunities are allowed if you are able to kind of find the opportunities. We don't have anything set up formally yet. Other perks, vacation days, we get 20 days. So that was increased from 15 days this past year. Conference days, you get 5 days, and then $1,800 for a meal stipend. You can also include that in your paycheck as well, but that will be taxed. Education fund as well. There's about $500 for PGY2, $800 for PGY3, and $1,200 for PGY4, in addition to the education fund you see here. So as a PGY4, for instance, you get actually $2,400 for education fund, half of it through Beaumont, half of it through the PM&R department. And these, you can also find this information online as well, but these are the fellowships where people go. So this past year, we have Dr. Ziss for the new fellowship. We have another previous PGY4 going to Interventional Spine Cleveland Clinic. You see Cleveland Clinic pretty much every single year in the last 5 years. And then Michigan State, this is the joint ACGME sports, and then Interventional Spine is the first year non-ACGME. So it's a 2-year program that Jensen went to. And then Angelo Allos is at University of Michigan. And then quite a diverse interest, pediatrics, you see here, Parkinson's and movement disorder, hospice palliative care, as well as brain injury medicine. This is Dr. Trevax, who went to Case Western. All right, I'll hand it off to Dustin and Ray to talk a little bit about what else we do in Michigan.
A lot of everything. Like I said, a lot of golf courses around here if you like golf, a lot of breweries, a lot of places to shop, sports. Detroit is on the up and coming. So downtown Detroit is always fun to go down there. Hopefully the Tigers and the Red Wings and the Pistons and the Lions are going to get a little bit better, but we'll see how that goes. And then the Michigan Wolverines are about 20 minutes away. So we do a lot of fun things outside of residency, have a lot of fun at work too. So if you're looking for a, fun place to work and learn a lot, probably be a good program for you.
Hey, Beaumont Royal Oak, I am so sorry, but you are out of time. You're definitely welcome to stay on the call and moderate the chat for a couple minutes. So if anybody wants to ask any questions for Beaumont Royal Oak, and you can put them in the chat and they can respond directly in the chat. Thank you so much for a great presentation.
Thank you for having us.
Of course.